How to treat patients with cholesterol issues like hyperlipidemia. So you can base it off of the heart risk calculator if you're ever concerned about whether or not your patient requires a statin medication. And so you simply can go to their website as you see there. You just type in the age of the patient, the gender, the race, and then you go off of their labs that they had done for their lipid panel, typing in their total cholesterol, their HDL, and then of course their blood pressure, and then whether or not they're treated for high blood pressure, diabetes, or that they're a smoker. Then it kind of pumps out a number for you and gives you an idea of whether or not they'd have risk factors for needing cholesterol lowering medication. Typically all patients who have type 2 diabetes or even type 1 diabetes are recommended to be on a cholesterol lowering medicine. So just something to consider. So you don't always have to put those patients into this risk calculator if you don't, if you know that already. Here's an example of a patient's cholesterol numbers. So you can kind of go over these with the patient at the office visit or via telephone, depending on your practice at your clinic. So the total cholesterol should be less than 200. This patient's at 252. Triglycerides come from eating fried and fatty foods, should be less than 150. This patient is at 221. HDLs, your good cholesterol, should be greater than 40. They're at 44. That helps protect your heart. And then your LDLs, your bad cholesterol, should be less than 100. They're at 164. And your VLDL is also bad cholesterol, should be less than 40, and they're at 44. So as you can see on here, this patient does not have the best of cholesterol, and if you put their numbers in, most likely they would need a cholesterol-lowering medication. So in terms of treatment for patients with elevated cholesterol issues, there's a lot of medicines to choose from. Typically, the medications that are used are statins. However, not all patients tolerate statins, or they want to try something more or less that's found over the counter. Certainly they can try niacin if they would like to, or fish oil if they would want. Niacin has been known to cause facial flushing, and so it's not always the best medication to choose from if they're having that as a side effect. As you can see on here, it kind of tells you the percentage of decreasing the LDL, the bad cholesterol, increasing the HDL, which is the good cholesterol, and decreasing the triglycerides, which come from fried and fatty foods. So again, it depends on what your goal or objective is for that particular patient based on their lipid panel. You can kind of see on here what you would choose. PCSK9 inhibitors are typically limited to cardiology ordering these medications. You have a lot of times a lot of difficulty getting insurance to cover those medicines since they're extremely expensive and they're injectable medications. They usually have to have some sort of reason why they need it, whether they failed several statin medications because they had side effects and they're not eligible for other medications on this list due to cardiovascular or vascular issues that they have. Again, this can be really tricky to get those prescribed, so usually I refer to cardiology to order those medications, again, if all else has failed and they really need something to decrease down their cholesterol numbers. So just some thoughts here. Simvastatin or Zocor or rosuvastatin or Crestor can raise the HDL, your good cholesterol, more so than some of the other medications. Atorvastatin or Lipitor and Crestor are more effective at lowering the triglyceride levels than other statins as well. So just some things to think about. When you make a decision to treat a patient, you can pick like a moderate dose statin. Just some examples are kind of listed below to choose from. And so, again, this is practicing medicine, so it's up to you to determine what you want to do. A lot of times I prescribe Lipitor, whether it's 10 or 20 milligrams as a starting dosage, or Crestor 5 to 10 milligrams as a starting dosage. It just, again, depends on your patient's allergy list and if they've tried statins in the past and if they had any side effects to that. This is just the LDL reduction based on the statin. A lot of times we want to reduce the LDL levels. This is just another kind of spreadsheet to kind of reflect and show which statins kind of reduce the most for the bad cholesterol, the LDL cholesterol, as you can see kind of here as follows. Now, if their patient comes in and they're adamant that they cannot tolerate the statins, that they've had myopathy related to statins, typically it occurs in your legs, and they just are not willing to budge on that, you can trial other medicines. Typically, I prescribe either Lopid, 600 milligrams twice daily for those particular patients. Gemfibrozol is the other name for that, or Zetia, 10 milligrams once daily to help. Again, those medicines are not considered statin medications, and they will reduce down your cholesterol numbers. They just do not work as well as statin medication, so they're not technically ideal, but at least is better than nothing, so to speak. Otherwise, certainly they can try like fish oil, red yeast rice. Those are over-the-counter supplements that you can find. You can even give them a bile acid sequestration, which is Questran, for example. It's a powder that you mix with water, and they can drink that, and it can reduce their cholesterol numbers. Otherwise, if they're willing to trial a different cholesterol-lowering medicine, pravastatin has actually been shown to have a lower risk of producing myopathy than the other statins. So you could start that at either 10 or 20 milligrams once daily. Again, it depends on your patient's lipid panel and what your goal is for them. If you really don't want them to get off of that statin medication, trialing CoQ10 found over the counter first, if possible, is a better choice for them. A lot of times CoQ10 prevents them from having the myopathy that they may experience. However, some patients, again, are reluctant to try that, or they've tried it and it doesn't really make any difference for their symptoms in terms of the myopathy, and they just can't tolerate it. So just some options for you, again, depending upon those patients. Of course, all patients should be educated upon what the recommendations are in terms of eating a heart-healthy diet that's low salt. You certainly want to have low-fat meats that they're eating, more fruits and vegetables in the diet can help. Of course, smoking cessation, if they do smoke, makes a difference in terms of this as well. Just some things to consider. Now, if your patient is absolutely refusing to be on any sort of cholesterol-lowering medication, whether it's a statin or not a statin, that is ultimately their decision. Just make sure you document that in your notes, that they are refusing to be on those particular medications, and that they're, of course, at increased risk for cardiovascular, issues related to that. So just making sure that they're educated on those facts is important. And then letting them know if they do change their mind in the future, that they can always be put on something at that time, and that you should recheck their lipid panel at least every 6 months, if not sooner, again, based on what their numbers are. And a lot of times these patients want to try dietary changes first to see if that makes a difference in their in their numbers. And they're more than welcome to do that. Again, nothing necessarily that they do dietary wise, again, based on their lipid levels, maybe enough to get the numbers down. I've seen that quite frequently, is their numbers will be a little bit better, but they won't ever get to kind of the goal numbers that you want them to have. So again, just kind of close follow-up and monitoring those patients and explaining that to them may be beneficial in those cases.